Good morning. So this is the second day of our workshop, and yesterday was a tough day. We had 5 cases, 5 ureteroscopies. Fortunately, everything was good, but there were quite difficult cases. This day, the second day, is also previewed with 5 ureteroscopies and also with new technology. And please start the presentation. So this is our workshop 2025 news in ureteroscopy, perspectives for 2026. Next slide, please. And here I put some examples from our experience. You can say more than 26,000 ureteroscopies, and here there are 12 lasers that we used and some aspects, intraoperative aspects. Next slide, please. And here is the team. I am so glad and happy to have a very dedicated team. Here there are 16 from our department, clinical department, St. John Emergency Clinical Hospital. And you can see here young urologists, they all practice ureteroscopies, and the endurologic activity is quite important in this clinical department. That's why we use ureteroscopy, because, you know, in this field we have a recognized experience not only in our country but also internationally. The next slide, please. Yes, this is a very important slide. I am so grateful to the sponsors and to the companies that were near us. So I put here, I think, the best companies in the world, and you can see here Pusen, you can see Quanta System, Storz, Wellit, Clearpetra, Boston, Olympus, Hawk, also Mincion, Cook, also you can see Igaomed, and of course HugeMed, Dornier Tullio, Vetkang, Vivian, and this is Wolf, and of course Innovex. So with this slide, I have to say that Romania is very strong. Why is strong? Because the representatives are very strong. Here, this slide, in fact, represent also the representatives. All these companies have in this, you know, in Romania, very good representatives. So we work with them, and really I appreciate a lot their dedication, and only because of them this workshop was realized. The next slide, please. Yes, these are one example only with 5 lasers, the best of the lasers from these companies. And of course, I put here Multilaser Storz. I put here Tullio from Dornier. Also, I put Magneto. In the next case, we'll use Magneto. It's a CyberHo 100 watts. It's a really great laser. Also, the laser that we used yesterday, it's the fiber dust. Very good laser, and the quality of the dust was great. And also I put here our everyday laser is Wolf. It's also, in fact, Quanta system technology. And the last slide, I think, the next slide. Yes, this is the program from yesterday, and the next slide, this is the program for today. And we will start with the case number 6. This case will be presented by Professor Bogdan Geavlete, and he will operate this case, and of course he will present the technology and the Ureteroscope and the case like I said.
So this is the case of a 32 years old male patient with one stone in size 9 per 8 per about 7 millimeters. So total stone volume of 233 cubic millimeters, a stone density of 1,200 Housefield units, and a negative urine culture. During the course of the procedure, you shall use the single-use flexible ureteroscope from Pusen with a 7.5 French caliber, a 3.6 French working channel, and suction. Also, we shall use a classical or traditional, if you want to call it, access sheath without suction from Boston Scientific or Cook of 10 or to 12 Sharia. Also, the Polaris loop ureteral stent from Boston Scientific, and for the laser lithotripsy, the CyberHo laser generator Magneto, the Quanta system. So dear friends, it's a great pleasure to be with you today and share part of our experience with Ureteroscope that's very dear to us. That's the 7.5 French scope from Pusen. We have been using it extensively in our experience over the past few years with very good results. The device in suction gives us a great advantage, as I will show you throughout the procedure. We'll be using the 10 to 12 Sharia access sheath from Cook, and also very efficient laser that we highly appreciate, the Magneto CyberHo 100 watts from Quanta system with predefined dusting mode of 8.4 joules, 8.4 watts, 0.7 joules and 12 hertz. That is specifically designed for this type of lithotripsy. We have to keep in mind that dusting is an extremely important part of this procedure because it enables you to optimize the suction through the working channel. This is a thin, very maneuverable, excellent accessibility ureteroscope, but the working channel of 3.6 French imposes a very good fine dusting in order to really benefit from the suction process. Okay, so we shall begin the procedure. The access sheet is already in place. The water is running, so we shall see where we're at. Okay, so we're in the kidney now. The stone is in the inferior calyx, but we shall do an inspection of all the caliceal cavities just to make sure that there are no other fragments left behind. The patient was pre-stented, so the access by access sheet was quite easy. Now there's a lot of debate going on in the international meetings about the eventual, there's the calculus, there it is, okay, about the usefulness of pre-stenting. And there are opinions, pros and cons. Let's put the fiber in, please. So there are opinions, pros and cons about this topic. Our experience is that in the greatest majority of cases, having a double G stent before the procedure facilitates the access and almost guarantees being able to use the access sheet. The access sheet is tremendously important in terms of irrigation and vision, and therefore we are strongly convinced that this facilitates the various technical steps of the procedure. Where in the calyx we have the laser fiber in place. We're going to go as close to the stone as possible, and we shall begin the procedure. As you can see, I tried to move as much as possible around the surface. Okay. Of course, there are the movements of the patient which obviously do not help us, but they're somehow unavoidable. Okay. The idea is to remain on the surface and break the stone gradually, and to avoid, of course, as much as possible, when possible, the production of big fragments. Going to the very core of the stone and breaking in half clearly will not improve your stone free rate. Okay? So the dusting mode means having a little bit of patience. That's important. Well, I think it's important in any urological procedure, but for benefiting from the suction, I think this can be a real threshold. You can see that the dusting works also for smaller fragments. So the idea that if a fragment of a few millimeters got away, it means you can no longer do dusting. With the Magneto, that's possible. You can still do dusting. Just to make sure that these fragments you'll be able to aspire in the end. Okay, so let's return to the main stone. The advantage of the inferior calyx is that the fragments have no place to go. So you can finish your lithotripsy very locally, so to speak. Of course, there's always the choice of basket relocation that has also been discussed in several studies, and for really acute angles and narrow infundibulum, that could be the solution. Yes. So now we shall move to the second dusting mode that really increases a little bit power, and you can see practically vaporizes the smaller fragments. Well, they were small enough for spontaneous passage, but we want to be perfect in terms of stone free rate, and you can see that this is pretty much a reality. Okay, let's do it here too. We still have some very small but still visible fragments. Okay, and here.
This is a special mode. It's 14 watts now, 14 watts, 0.7 joule and 20 hertz. A little bit, the power is a little bit higher, but look, the efficiency is also dusting, but it's a special dusting from Magneto, special dusting.
So you can see that the fragments are growing quite insignificant, and we shall use another suction moment now to take out what's left of the debris. Of course, this was not a very big stone, but for stones of 2 to 3 centimeters, that can be quite useful, because the idea is to prolong your procedure and see well during the long and difficult stages of lithotripsy. Right. Okay. Let's have some water. Okay. Okay, so what we'll do, just a little bit more here, and we're very close to the end. Let's go. So pretty much done, because this looks very clean. This you won't see, not even on CT, perhaps 1-2 millimeters. We shall do one final aspiration here, and as you can see, the inferior calyx has been cleared from stone, from a 1 centimeter stone. So That went really fast and efficient. And now we're taking out what's left of the debris, because these very small fragments could be, as it has been shown also in the guideline, the source for future stone recurrences, right? Okay. So I think this is very, very nice. So at the end of the procedure, we won't even need a double G stent, because there are no fragments that could actually block the ureter in the next days. So thank you very much for your attention, and we shall see each other again on the 9.2 French from Pusen scope on another procedure. Thank you.
So the question is, this could resolve everything. I mean, could resolve the stone and, you know, the little fragment that you saw? Yes, it's possible. But in special cases, not in all cases after our experience. But the procedure was very clear, demonstrating the performances of this laser and of this ureteroscope. Absolutely great ureteroscope, 7.5 with suction from Pusen. So we will move to the next case, the case number 2, and now they will prepare for the double J, Polaris double J. Okay.